Hello, I'm Colby. I'll be your nurse today.
Hi, my name is Mika. I'll be your nurse.
What seemed to happen to you?
Oh, I was just walking around campus today and wasn't paying attention. It's beautiful outside, and I was texting, and that sidewalk just came out of nowhere.
Alright, well, we'll get looking at it. We're just going to wash our hands and put some gloves on first, okay?
Alright. Yeah, it's a wild-looking raspberry I got there.
Oh, no.
Could I have you lift up your arm for me real quick, please? I'm just going to put this underneath here just in case any fluid leaks out. Yeah. Now I'm just going to carefully take off this bandage you got on here. Alright, now I'm going to assess your wound. I'm going to assess for the color, shape, size, depth, and drainage, and see if there's any inflammation around the wound. Alright, now I'm just going to measure the wound. Oh, it looks like it's about 5 centimeters with an irregular border. Alright, now that we've done assessing the wound, I'm just going to remove my gloves and wash my hands, and then we'll get to treating it.
So now we're going to prepare the supplies. Okay. So we have a 4x4 gauze for the wound. We have a gauze roll to secure it with and tape. We have a syringe to clean the wound as well as sterile saline. And some Q-tips taped to the side of the table to use to clean the wound as well. Okay, next I'm going to use some sterile saline in my syringe and rinse the wound from top to bottom. Okay. I'm going to take a Q-tip and dip it in the sterile saline. I'm going to use it to clean the deeper portions at the bottom here. I'm just going to roll. Get a new Q-tip each time. I'm going to rinse it off one more time just to get the extras off. Wow, that looks a lot better. Okay, so I'm going to take one of my clean Q-tips and I'm going to put Bacitracin around the wound. I'm going to use a clean Q-tip for each area. Okay, looks good. Okay, so now I'm going to take my 4x4 gauze, place it. Actually, can I have you lift up your arm and just bring it back out of that area? Okay, so we're just going to put the new gauze over. So I'm going to take my roll of gauze. I'm going to secure this down. Can you lift your arm up off the table for me? Alrighty, and I'm just going to secure that with some tape. you. There we go. Okay, so I'm just going to initial and date here on the edge. Alrighty. And I'm going to send you home with some supplies just like we did today, so you can change it every other day or anytime it gets wet or anything. You want to avoid getting it wet as much as possible though.
Okay.
And I'm going to have you, each time you change it, inspect for any signs of infection, so any redness, any temperature change, like if it gets warm, if you notice any strange odors or any drainage, so that means just any kind of gooey stuff coming out, you want to just go ahead and give us a call and we'll help you out.
Okay. Sounds good. Other than that, I'm good to go.
Alrighty, what'd you learn?
Don't text and walk and try and chew gum at the same time.